Hello everyone, I'm David Farzam and welcome to New Cancer Mentality. This is part 2 of the 3-part series, Cancer in the Post-Genomic Era, Where Do We Go From Here? What Will It Take to Prevent and Cure or Control Cancer? In the first part of this series, Dr. Glazier made the case that cancer is an enormously diverse, unpredictable, stochastic evolutionary process that occurs in the body. We will now discuss, in the light of evolution, what is required to prevent and reduce the risk of developing cancer. In part 3, Dr. Glazier will discuss requirements for the cure or control of cancer and propose practical ways of bypassing the staggering genetic complexity of the disease and specifically cure or control metastatic cancer. He will also talk about a proposed research approach for the treatment and cure of brain cancer. It is a pleasure to have Dr. Arnold Glazier back on the New Cancer Mentality website.
Thank you. I'm delighted to be back.
So Dr. Glazier, before we get into the science, could you give us a list of practical things that people can do to reduce the risk of developing cancer?
Yes. Bo Aldershay, founder of the Prevent Cancer Foundation, discussed some of these on a previous webcast on your site, but they bear repeating. The single most important step for the prevention of cancer is not to smoke or to quit. Smoking is now the #1 preventable cause of death worldwide. If current rates continue, smoking will kill 1 billion people. 1 billion people during the 21st century. So do not smoke, don't use chewing tobacco, don't drink alcohol only in moderation, maintain ideal body weight, exercise regularly, cook meats at lower temperatures. Don't eat burnt meats or well-done meats. Decrease red meat intake. Don't eat cured, processed, or smoked meats. The nitrates are bad news. Increase vitamin D intake to 15 to 2,000 units per day. Limit sun exposure and use sunscreens. Never use tanning boots. Increase fruit, vegetables, and whole grains and nut intake. Women should avoid hormone replacement therapy. Get immunized against hepatitis B and human papillomavirus. Get screened for colon, breast, cervical, and skin cancer as per guidelines. Discuss any family history of cancer with your physician. Test your home for radon, and if you have a well, test your well water for arsenic and heavy metals. And you want to avoid exposure to smoke, fumes, and industrial chemicals. Avoid inhaling particulate matter. And wear a dust mask if you're sanding or generating fine dust. Avoid unnecessary x-rays and unnecessary CAT scans. Men and women with a strong family history of ovarian or breast cancer should get screened for BRCA mutations. Women at high risk for breast cancer should consider taking tamoxifen or raloxifene and other prophylactic measures. H. pylori infection, a common cause of ulcer, should be treated and eradicated. Most of these are fairly simple steps, and if a person follows these steps, they would markedly reduce the risk of getting cancer.
Thanks. So let's get on with trying to make sense out of the whole area of cancer prevention and risk reduction. Why does it matter that cancer is an unpredictable evolutionary process? What relevance does this have to cancer prevention?
As we discussed in part 1 of this series, cancer results from evolution that occurs inside the body. Just to review, the necessary and sufficient conditions for evolution are random variation, reproduction or cell proliferation, heredity or transmission of variations to offspring, and selective pressures which result in competition for survival. Random variations that confer a reproductive or survival advantage are naturally selected for and become enriched in the population. New random variations arise and the process repeats. Runaway evolution inside the body results in cancer. To completely prevent cancer requires halting evolution in cell populations in the body. To reduce the risk of developing cancer requires slowing evolution in the body.
In part 1 of this series, you pointed out that evolution inside the body is inevitable, but that most evolutionary populations do not progress to cancer. and that even when early cancer does develop, it often poses no risk to the patient, since many early cancers will never progress. What impact does this have on the effectiveness of cancer screening and early detection?
First, screening for breast, colon, cervical cancer, and melanoma can be life-saving, and I would urge patients to follow recommended guidelines and get screened. Prostate cancer screening is a bit more complicated. Whether a man should get a PSA test is best determined after a discussion between the patient and his physician. Having said that, let me now answer your question. The evolutionary nature of cancer poses severe challenges to the paradigm of cancer screening, early detection, and early treatment. If we use sensitive biomarkers to detect evolutionary cell populations and very early cancers, we will find them and end up detecting and treating a lot of early lesions that, if untreated, would never harm the patient. We can end up doing harm to the patient by overtreatment, especially when the treatments have significant side effects. Furthermore, screening has little impact on the most dangerous cancers, which grow fast, can spread between screening intervals, and are highly unpredictable.
What percentage of very early cancers never progress?
The exact number is unknown. Half of all childhood neuroblastomas would never cause disease. 50 to 85% of untreated ductal carcinoma in situ do not progress to invasive cancers over 10 years. At least 60% of prostate cancers are clinically insignificant and will not harm the patient. The problem is that many early cancers will progress and cause serious disease if untreated. Since tumor cell evolution is an unpredictable process, which we cannot know which early lesions will progress and which will not. The situation is especially troublesome when the treatment causes significant side effects, as is the case for prostate cancer.
Can you explain in more detail the dilemma posed by prostate cancer?
Prostate cancer is just a huge problem. About 218,000 men were diagnosed with prostate cancer in 2010. Over 32,000 men died from the disease in the United States alone. Most men will develop prostate cancer. In an autopsy study, prostate cancer was detected in 50% of men aged 61 to 70, 65% of men ages 71 to 80, and in 87% of men over age 81. Prostate cancer was detected in 24% of men age 55 and older by biopsy. Now, at diagnosis, most prostate cancer is early stage, and most patients will remain symptom-free without therapy. For every 100 men diagnosed with prostate cancer, about 62 will remain symptom-free without any treatment. 38 will develop symptoms, and 8 will ultimately die from prostate cancer. PSA screening results in the detection of many cancers that are clinically insignificant and doesn't have a large impact on the death rate from prostate cancer. To prevent one death from prostate cancer over a 10-year period would require screening approximately 1,410 men and treating an additional 48 men. The problem is that current therapies frequently cause serious side effects that impact quality of life, such as erectile dysfunction, urinary incontinence, and bowel urgency. The bottom line is that treatment is worse than the disease for most men, but life-saving for some.
Would it be possible to develop biomarkers to predict which men with early-stage prostate cancer will develop progressive disease and need treatment in the future?
No. Existing aggressive prostate cancer can be detected. For example, a high Gleason score, 8 to 10, indicates the presence of aggressive disease. But it is not possible to predict if aggressive disease will evolve from low-grade lesions. As we talked about in Part 1, tumor cell evolution is fundamentally unpredictable. Furthermore, prostate cancer cells can escape from the prostate at an early stage of the disease. Cancer cells can be detected in the bone marrow of approximately 10% of all patients with early stage prostate cancer before prostatectomy or radiation therapy, and in about 30% of patients if ultrasensitive PCR detection technology is employed. It's these disseminated prostate cancer cells that ultimately lead to metastatic prostate cancer and lethal disease. So here's the problem. Most men will develop prostate cancer. Most prostate cancer will remain harmless, but some will be fatal unless treated. It is not possible to predict which early stage prostate cancer will become dangerous, and existing treatments often cause severe side effects.
Is there a solution to this problem?
Yes. By far, the best solution would be to completely prevent prostate cancer in the first place, especially in men who are at high risk for the disease, such as those who have multifocal high-grade PIN. Prostate cancer evolves from the precancerous condition high-grade PIN.
There has been no success in reducing the risk of prostate cancer. Selenium and vitamin E failed. The drug turimifene failed. The drug Avodart failed to reduce the risk of developing aggressive prostate cancer. How can we completely prevent prostate cancer when we can't even reduce the risk of developing the disease?
Complete prevention is a different problem. The requirements for completely preventing cancer are different from those for reducing the risk of cancer. The solutions are different.
What would be required to completely prevent cancer?
To completely prevent cancer, it is necessary to halt evolution in cell populations in the body. This requires eliminating at least one of the necessary and sufficient conditions for evolution. Genetic variation, heredity, and selective pressures cannot be eliminated. Therefore, the only way to completely prevent cancer would be to completely and permanently abolish proliferation in a cell population. This is exactly what nature does. Most cells in the body cannot proliferate and cannot give rise to cancer. The single most important tactic that nature uses to prevent the development of cancer is to permanently abolish the ability of cells to proliferate without killing the cells. This is accomplished by, among other things, shutting off expression of a class of proteins called MCM proteins. MCM proteins are involved in DNA licensing and are absolutely required for cell proliferation. Most cells in the body lack MCM proteins, cannot proliferate, and cannot serve as an evolutionary source for cancer.
Could we use the same approach that nature uses to prevent cancer, that is, by permanently abolishing cell proliferation without killing the cells?
Yes, in special cases. As a practical matter, cell proliferation is not essential for general health and well-being in the following special sites: the prostate, the breast in postmenopausal women, the brain and spinal cord, and the retina. Permanently abolishing cell proliferation locally at these sites would completely prevent the evolution of cancer in these tissues. It would also consistently cure cancer localized to these sites without causing severe side effects to the patient. With modifications that are beyond the scope of this discussion, this approach could also be used to cure non-muscle invasive bladder cancer and to prevent new bladder cancers from arising in the patient, which is a big problem. Bladder cancer has the highest recurrence rate of any cancer, approximately 75%, and many bladder cancer recurrences result from evolution of new cancers in the patient.
Are there existing drugs that could be used to do this?
Yes. but this is a totally neglected area that deserves attention. Drugs exist that can permanently abolish the ability of cells to proliferate without killing the cells. A single brief exposure of cells to the drugs is all it takes. The drugs work by permanently shutting off normal cellular machinery that is absolutely essential for cell proliferation. They work independently of the underlying genetic and epigenetic alterations. A single treatment involving the local administration of such drugs could prevent the development of prostate cancer, breast cancer, and retinoblastoma in high-risk individuals. These drugs could also provide a practical way to cure organ-confined prostate cancer without causing the severe side effects that frequently accompany current treatments, such as prostatectomy, radiation therapy, and high-intensity ultrasound. Locally abolishing the potential for cell proliferation could also provide a means to cure brain cancer and eye cancers such as retinoblastoma and ocular lymphoma without severe side effects. We'll come back to the topic of developing a cure for brain cancer in part 3 of this series of webcasts.
Okay, what's required to reduce the risk of cancer, as opposed to completely preventing it?
To reduce the risk of cancer, it's necessary to slow the rate of evolution. There are two ways to slow down evolution. The first is to decrease the rate of genetic variation. This involves minimizing exposure to agents that damage DNA, such as cigarette smoke, radiation, sunlight, burnt meat, processed foods with nitrites, and viruses like hepatitis B and papillomavirus. The second is to decrease the rate of reproduction or cell proliferation. The anti-estrogen drugs tamoxifen and raloxifene decrease cell proliferation in the breast, slow down evolution, and reduce the risk of developing breast cancer by about 50%. Caloric restriction is known to lower the rate of cell proliferation and cell survival and decrease the risk of developing cancer. Prolonged, severe caloric restriction, a 30 to 40% decrease in calories, markedly reduces the risk of developing cancer. For example, 90% of rats treated or exposed to the potent carcinogen DMBA developed breast cancer when maintained on a diet with normal caloric intake. However, breast cancer developed in only 20% of DMBA-treated rats placed on a diet in which caloric intake was restricted by 40%. Conversely, obesity increases cell proliferation by means of a variety of growth factors and promotes the evolution of cancer. As emphasized by Bo Alderjay in a previous New Cancer Mentality webcast, exercise, proper diet, and avoidance of obesity are really important. It's estimated that eliminating obesity would decrease the risk of developing cancer by about 20 to 30%. Surgical removal of precancerous evolutionary lesions, such as colonic polyps and premalignant skin lesions, also reduces the risk of developing cancer.
Is continued exposure to carcinogens required to cause cancer?
No. DNA has a long memory. Genetic alterations caused by carcinogens are permanent and can trigger the process of tumor cell evolution, culminating years to decades later in cancer. There is solid experimental evidence from animal studies that even a single exposure to carcinogenic compounds can trigger tumor cell evolution and cause cancer. For example, exposure of rats during fetal development to a single, extremely minute quantity of the carcinogen N-methylnitrosourea causes cancer when the rats mature into adults. There is every reason to believe that the exposure of developing babies to carcinogens can similarly lead to the development of cancer in adulthood decades later. Having said that, the data is very clear that stopping smoking decreases the risk of developing lung cancer. After not smoking for 10 years, the risk drops about 60% compared to people that continue to smoke. However, even after 40 years of abstinence, the risk of lung cancer is still as much as twofold greater among smokers than in people who never smoked.
For a non-smoking individual, what would you say are the most important source of carcinogens?
It differs. In underdeveloped countries, HIV, hepatitis B, arsenic in drinking water, and toxic waste. In the United States and developed countries, food.
Food? Are you talking about insecticides and man-made chemicals in the food?
No, I'm talking about food. Food is by far the major source of chemicals absorbed into the human body, and under ordinary circumstances in non-smokers is the major environmental source of mutagenic and carcinogenic exposure. Now, the consumer is at the mercy of the food industry and government to ensure that potent carcinogens such as aflatoxins and polyaromatic hydrocarbons and heavy metals are not present at high levels in food. However, well-done meats are another story. For many people who do not smoke, the largest source of carcinogen exposure is probably well-done meats.
Can you explain in more detail the problem with well-done and burnt meats?
In 1939, Dr. Widmark discovered that extracts of broiled meat caused breast cancer when applied to the backs of mice. 25 years later, carcinogenic polyaromatic hydrocarbons were discovered in grilled beef. A 1-pound charcoal broiled steak had the same amount of the potent carcinogen BAP as about 200 cigarettes, and a T-bone steak was equivalent to over 1,600 cigarettes in BAP content. In 1977, Dr. Sigamora and his co-workers demonstrated that grilling sardines generated potent mutagenic and carcinogenic compounds. These observations have since been extended to all types of meat, chicken and fish cooked at high temperatures. Red meats are especially problematic. The carcinogens which form in well-done meats are similar to those generated from the burning of tobacco and include polyaromatic hydrocarbons, heterocyclic amines, and nitrosamines. These carcinogens bind to DNA, increase genetic variation, increase the rate of evolution, and in animals have been shown to cause cancer. DNA complexes of these food-derived carcinogens are readily detected in human tissues in people who eat well-done meats. A large amount of epidemiological data indicates that the consumption of red meat, and especially well-done meats, are a major risk factor for breast, prostate, colon, and pancreatic cancer. The importance of diet and lifestyle to cancer prevention is demonstrated by the low rate of cancer among Seventh-day Adventists who are vegetarians. The age-sex standardized cancer mortality in Seventh-day Adventists is about 1/2 to 2/3 that of the general population.
As a practical matter, what can be done to reduce exposure to these potent food-derived carcinogens?
Well, first, do not eat burnt or well-done meats. And meat should not be cooked using high-temperature methods such as barbecuing, grilling, broiling, over an open flame, over charcoal, over burning wood, frying in a pan at high temperatures, in oil at temperatures above 375 degrees. All of these methods expose the surface of meats to excessive temperatures that can lead to the formation of high levels of carcinogens. Do not brown meats. Do not use pan drippings for meats to make gravies. The carcinogens concentrate in pan drippings and residues and can be many times higher than the cooked meat. Do not expose any foods to a naked flame. Food should not be burned or charred regardless of the type of food. People should eat less red meat. Chicken and fish form fewer carcinogens than red meat. Processed foods such as hot dogs, bacon, salami, cured ham, salt cooked fish, bologna, sausages, packaged lunch meats, and jerky that contain nitrites constitute a significant cancer risk and should not be eaten. Smoked products contain highly potent carcinogens and should not be eaten.
So what are some safe ways to cook meat to prevent cancer risk?
You want to use lower temperatures, stewing, boiling or poaching, cooking in a slow cooker, microwaving, roasting, baking at 385 degrees Fahrenheit or less, covered with a lid or aluminum foil, steaming. Following these recommendations will dramatically reduce your exposure to potent dietary carcinogens derived from meat.
What other things can people do to reduce carcinogen exposure from food?
Avoid buying imported food from parts of the world where environmental regulation is lax and quality control deficient or non-existent. Beware of herbal dietary supplements. Billions of dollars are spent on herbal supplements which are largely unregulated and uncontrolled for safety. An outbreak of kidney failure and kidney cancers was traced to herbal dietary supplements containing the extremely potent carcinogen aristocolic acid. Other herbal products contain other known carcinogens. It's better to eat wild salmon and avoid or limit intake of farm salmon. Farm-raised salmon contain levels of carcinogenic and mutagenic chemicals such as dioxin, PCBs, and pesticides that are enormously greater than those of wild salmon. Don't take medically unnecessary iron supplements. Iron is absolutely essential nutrient and is required for health. However, the typical healthy adult who eats a well-balanced diet and is not iron deficient should not take iron supplements or iron-fortified vitamins. Iron is a pro-oxidant that catalyzes the formation of highly reactive oxygen species and free radicals. Iron has been shown to cause DNA single and double strand breaks. The combination of iron and vitamin C is especially potent at generating toxic reactive oxygen species.
Can reduction in dietary carcinogens really make a big difference in the death rate from cancer?
Yes, the benefits can be huge. In 1930, stomach cancer was the leading cause of cancer deaths in the United States. In 1970, stomach cancer had fallen to number 8 as a cause of cancer deaths. The use of refrigeration inadvertently reduced exposure to meats and foods preserved with nitrites. Upon cooking, nitrites are converted into highly potent cancer-causing chemicals. Rates of stomach cancer plummeted as refrigeration became widespread and nitrite exposure dropped.
Are there certain foods or drugs that can reduce the risk of cancer by decreasing DNA damage, decreasing genetic variation, and slowing the rate of evolution in the body?
Not that I'm aware of. There have been a lot of claims made, but none that have really stood the test of time. For example, vitamin A and beta-carotene actually ended up increasing the risk of lung cancer. A very large study involving over 100,000 people found no benefit from fruits and vegetables on the rates of cancer. A study of 40,000 women over a period of 10 years showed that vitamin E and aspirin did not prevent cancer in women. The problem is that there are a very large number of different mechanisms by which DNA damage can occur. And how many of these different mechanisms can any single food or drug address? Not many. Chronic inflammation causes DNA damage and increases the risk of cancer. For example, people with extensive ulcerative colitis, an inflammatory disease of the bowel, have a 32 times increased risk of developing colon cancer. To my knowledge, anti-inflammatory drugs have not been shown to convincingly reduce cancer risk.
Are you optimistic about the prospects of cancer prevention and risk reduction?
Yes, there is a lot that can be done today to lower the risk of developing cancer. And as I discussed, there are good reasons to believe that prostate cancer could be completely prevented in high-risk men by halting evolution within the prostate using existing drugs. However, prevention risk reduction has its limits. The carnage of cancer will continue until we develop therapy that can cure or control metastatic cancer. In part 3 of this series, we will examine the requirements for the cure and control of cancer and practical pathways to develop therapy that can satisfy these requirements.
Thank you again, Dr. Glazier, for your time, and we look forward to seeing you in part 3 of this webcast.
You're welcome, and thank you.